Okay, so right now we're going to go inform Mrs. Hemmings about her baby. Her baby was 6 weeks early, which makes her premature and is at risk for a lot of diseases. Right now she has chronic lung disease, which puts her in intensive care. I'm sitting in front of Miss Casey. So I want to talk to you about your baby Danielle. I understand that we told you that you could take her home this week, but she has taken a turn for its worse. She has a fever of 100 degrees, and as you know, 6-week babies are premature, and she has chronic lung disease, so 100-degree fever could put her in a lot more damage if we sent her home. She needs to be in intensive care. It's okay. Do you want to take a minute? No, just she's going to be in intensive care, and we're going to have to watch her very carefully because she has that risk for pneumonia. She has a breathing tube right now because she can't breathe on her own. If these medications help her, she can be taken home next week. But because she is a premature baby, throughout her life she will have to come back for checkups because she's not going to be fully developed. Her whole life? Isn't she going to develop later on? It's not going to be her whole life, but throughout her baby until she's at least 2 years old, she needs to be back. Because there are some diseases like pneumonia that could actually, eventually lead to yes. So we're going to have to make sure that she is safe. She's going to stay in the incubator, and you can come visit her whenever you want. We'll show you how to change her diaper and take her temperature and everything to make sure that she's safe and everything. How did she get? Alright, so right now we're going to take a checkup on this baby. She has chronic lung disease, and that's why she has a breathing tube. The breathing tube helps her heart work a little less to get her oxygen to the lungs because her lungs are narrow and we don't want them to collapse. So right now we're going to take her pulse, and we're going to put our 2 fingers between the bone and the tendon on her radial artery. So we're going to count the beats that she has in 60 seconds. Okay, so it's going to be 35 beats. It's a little low than we really want it to be, but because of her breathing tube, it's normal. So now we're going to check up on her heart, and we're going to see if her heart is working too hard for her body, and we're also going to listen to the lungs to make sure that she's actually getting enough air that she needs to. Okay, her lungs are getting enough oxygen, and her heart's beating a little too fast, but it's normal because she has a breathing tube in her. So she has a fever, so we're going to give her Tylenol to lower that. And we're just going to do 1 cc of it because it's not that high, it's only 100. So we're going to give her through the mouth so she doesn't choke, and we're going to lift her head. Okay, and then we're going to give her penicillin to make sure that her antibiotics are still going strong and she doesn't get pneumonia. And we're going to give that through her vein because it gets to the antibiotics quicker. We're only going to give 2 cc's of that. And that's the workup what we do on a baby.